Hello everyone, welcome to So Jannelle. I'm your host, Jannelle So. We are now entering week 8 of quarantine here in California. We started around March 14th, mid-March, I remember. And now this is the first Sunday of May, and we are still in shelter in place or under shelter in place orders. So please guys, we need to follow that. Don't go out unless for essentials, and even some groceries, even some food, have them delivered to you instead of you going out and exposing yourself and exposing others. There's a lot of things we still don't know about the virus, even though it's been weeks, it's been months since this happened or since this broke out. And so here on the show, we're working very hard behind the scenes to give you relevant information, also told in a culturally relevant way as well, by talking to some of our experts who are Filipinos, and that way they can give us their experience as well and their tips, Filipinos to fellow Filipinos here on the show, because as you know, knowledge is power. When we educate ourselves with the right information, we also empower ourselves to deal with COVID. And that's what we're trying to do here on the show, week in and week out. I've been trying to tell you that we are hoping to share tools for you on how to manage with relationships, with your health, and with all the different things that surround us, that affect us, because this pandemic has definitely turned our lives upside down. Whether you are at home, whether you are an essential worker, whether you are a frontliner, it's been just very different for everyone. And week 8, of course, of quarantine or shelter-in-place orders, I know everyone is just itching, a lot of anxiety, and we're trying to manage that anxiety and stress by knowing what's really happening out there. And so this afternoon on the show, we decided to give you 2 very special interviews. The first one is to give us more information. Dr. Francisco C. is a professor and chair of Department of Environmental and Occupational Health at the University of Nevada in Las Vegas School of Public Health from June 16 to present. He has earned his Doctor of Public Health degree in Immunology and Infectious Disease in 1984 from Johns Hopkins School of Public Health. Here he is breaking down the finer points of this coronavirus into 10 different catchy and easily understandable points for us on the show. Here he is. Dr. C, thank you so much for joining us on the show today.
Thank you for inviting me.
I really like your idea of simplifying as much as we can the 10 points that we need to understand about coronavirus. The first one is that it's a novel virus. Can you expound on that?
It's something new. That means all of us are susceptible to it. Anyone can get it. The most easiest way is air droplets. When somebody coughs or sneeze, then the air droplets that come out is full of virus. And so you can inhale that and acquire the infection. Or if the person cough on their hands and touch another object, they could transmit it to another person through those objects, whether it's doorknobs or tabletops or other kind of objects.
And that's why it's being advised that we regularly clean a lot of the surfaces that we constantly come in touch with.
And also the social distancing of 6 feet, that's because how far when a person cough or sneeze, that's how far the virus could travel.
Your second point, Doc, easy come, easy go, because it's easy to spread, especially in crowded areas.
Yeah, because it's very infectious, so it's very easy to acquire and very easy also to transmit, because a person who's infected has a very high load of the virus in their nasal area. So when they sneeze and cough, all these viruses could travel in the air and you could inhale it and acquire it through air droplets. But air droplets, because of the gravity, would drop down to the ground. They won't stay very long in the air. Right now, because of lack of testing, not everybody get tested. So most people don't know their status. So the only way to do it is to make sure you have social distancing and also wear a mask so you don't infect other people, because you might be infected already.
Number 3, tip of the iceberg.
These cases and deaths that are reported are just a tip of the iceberg. That's what you can see. Underneath that, underneath the iceberg is a whole chunk of ice, which represent the people who are asymptomatic. So about 80% of the people who are infected don't have any symptoms, or if they have symptoms, it's very mild. That's why we practice this stay home lockdown, stay home, or shelter in place to make sure there's people don't mix with each other. and don't infect each other.
Number 4 point, sir, is fast and furious.
In a span of 4 months, it started in Wuhan, China in December 2019 to now. It spread to 185 countries. There are now 3,173,000 cases in the world with 225,000 deaths in the world. And in the US now we have 1 million cases and about 60,000 deaths. In the Philippines, we have 8,212 cases and about 558 deaths. So these are just percent of death over cases.
And you're also sharing some information about death disparities of COVID-19 deaths among Asian Americans.
If you look number of deaths, for example, in California, you have about 17.3% of the deaths in California are in Asians, but Asians only comprise 14.5% of the population in California. So it's disproportionate. In Alaska or Idaho and Vermont, where there are very few Asian, you can see that they're disproportionately represented too.
Number 5 point, heroes are coming along.
That means the frontliners that are dealing and treating patients with COVID, a lot of them are Filipinos. Half of the foreign nurses are actually Filipinos, and then about 6% of doctors are Filipinos. So they're in the front line now in New York, New Jersey, Chicago, and they're treating COVID patients. So there's a report that came out from CDC on April 14 that reported that there are about 9,000 healthcare personnel who were infected. Of this 9,000 plus healthcare personnel, 73% of them are female, 55% of them acquired it from their hospital exposure, and 90% of them were not hospitalized, they just stayed home because they have mild infections, and only about 27 died. So you can see here that the doctors and nurses could also be affected while treating patients.
In fact, after this interview, we're also going to be featuring a Filipino nurse from New York that tested positive, and I have been monitoring his situation and exchanging messages with him. And according to him, for nurses, if you don't have fever, even if you're coughing a lot, they expect you to still come to work. We're going to be talking about that, plus the continuation of from point 6 to 10 of this very concise breakdown of this coronavirus COVID-19 information when we return on the show. Don't go away.
If the coronavirus pandemic has affected your job or income through layoffs or reduced hours or pay, it can still be so easy to have an income during this interim period. If you become unemployed due to the coronavirus outbreak, you can file for unemployment benefits. You must be actively looking for work and be prepared to accept it immediately. Benefits range from $40 to $450 per week. If you're unable to work because you fell ill with COVID-19, first seek payment from your employer's sick leave program. If that is not an option, file a claim on www.edd.ca.gov, disability, for state disability benefits. If you have to take care of a sick dependent and cannot work during this time, ask your employer about a family leave program. If that's not possible, file for paid family leave through the Employment Development Department. Even if you were laid off through no fault of your own, it can be difficult to find another job due to business closures and social distancing. Don't be alarmed. There are still options for you.
Thank you so much for sharing your afternoon with us here on So Jannelle. If you missed our first segment, don't you worry, because we have started making this available on YouTube every Wednesday, Pacific time, 8 o'clock or 8 o'clock Pacific. You can catch the premiere on YouTube, and after then you can always watch at your own convenience. These full shows, commercial free, we are making available on our YouTube channel, youtube.com/SoJannelle. Also, we are adding extended versions of our interviews on the show. This is part of working from home. That wasn't planned, although some of you may already know Lily because she has been part of the show the last few Sundays with Life with Lily. Here is the second part of our interview with Dr. C. Dr. C, earlier we left off with your discussion of point number 5, heroes come along, but you're also adding the good, the bad, and the ugly.
So what I meant by good, bad, and ugly is that a lot of good things come out of this because people praise the frontliners, the first responders, and like in New York, for example, 7 o'clock at night, everyone clapped their hands and banged their door or their pots to show gratitude to the frontliners. But at the same time, the media have not described what happened to increasing racism, discrimination, and hate crimes that Asian Americans have experienced. It's been increasing because they're being blamed for the coronavirus, and some people even call it the Chinese virus.
In addition to everything that we're dealing with as Asians, we have to deal with as well. And I know that there are some medical frontliners that have been attacked in New York. There are reports about that as well, and it's very ugly. Going back to your points, Doc, number 6 is flattening the curve.
So what we meant by that is that we want to slow the spread of the virus. So that's why you put social distancing, stay home, wearing a mask. All of these are supposed to delay and slow the spread of the transmission of virus so that you keep people apart from each other. And that way, you do not overwhelm the healthcare system. Otherwise, you're going to see a lot of people with severe diseases going to the ER, going to the ICU, and they won't be able to handle them because of the large number of people getting the severe infection.
Point number 7, Doc, is there's no single magic bullet.
A lot of people ask me, is there a cure? Is there a vaccine? It will take a long time before you can find a vaccine or a cure because it's really hard to deal with viruses. It's easier to deal with bacteria using antibiotics or anti-parasitic drug, but for viruses, it really takes a long time. For example, for AIDS, it started in 1981, and by the time we found the cocktails, it was sometime in 1994, 1995. It took a long time before we found a drug for the viruses. So the same thing is true with the coronavirus. So actually, instead of looking for a single bullet, you should look for the combined strategies that work. For example, you can see that the hand washing technique, social distancing, the testing, and then isolating every case, and then contact tracing, and then quarantine, all of this work. And these are lessons we have learned from other countries like Singapore, Taiwan, Hong Kong, South Korea. They try this. And you can see that the death rate and cases are lower in those countries because they practice a combination of all of these different strategies together.
The number 8 is the most important question right now, as some governors here in the US are preparing to open their states, and some have already. When will lockdown end, and when will life return to normal?
So that's a good question, and you can see the government have different phases, and WHO also have 6 criteria that they use. But in all of this, the most important thing first is to see. In the US, for example, CDC guidelines show that we need to show at least 14 days of declining cases. Mm-hmm. And we're not there yet. If you look at most states, the number is still increasing. It does not decline. Mm-hmm. In New York, you can see there could be a plateau, but it does not decline. So you need to show 14 days of decline and also make sure there's testing available. Without those testing in place, it will be difficult to suddenly bring everybody together. So it's not like switching the light on and off. It should be more gradual, like when you turn your faucet in the morning, take a shower, when you try to mix your cold and hot water together, you have to slowly, gradually do it. So I think it's more a gradual process, not a very sudden opening right away.
And in fact, the World Health Organization has 6 criteria for lifting the lockdown restrictions. We're going to be discussing that in our extended version on YouTube. So make sure you catch us on YouTube. But for the purpose of this TV interview, Dr. C, your point number 9, empowering and education.
This time felt like they're hopeless about the situation. So you can actually empower yourself by trying to learn and educate yourself about the virus and sharing with your family and keeping your faith strong. And also update yourself. There are 4 websites that I recommend. You go to the CDC website for guidelines for prevention, NIH website to look for current treatment and vaccine, and Johns Hopkins Coronavirus Resource Center for the statistics. I think those are very important websites to learn more about the virus.
Right. And finally, ending on a positive note, your point number 10, sir.
We're all in this together, and this too shall pass. We've seen other epidemic. Eventually, it will be over, but it will take some time.
Well, thank you so much for joining us today.
Thank you for inviting me.
We have been filming from our house. Like a lot of parents, we are working from home, and like a lot of parents, we are working from home with children. Lily here has decided to appear on the show. Hi, Lily.
Hi.
You can catch more of her. She has her own YouTube channel that we started as well. It's called Life with Lily. But meanwhile, we are here on the show giving you a lot of information. We just finished our 2 segments, So Informed, with Dr. Francisco C., who broke down in 10 different parts what we know about the coronavirus. If you miss that, catch us online, youtube.com/SoJannelle, where you will find commercial-free full shows, also premiering every Wednesday. So you can join us with some of our guests and experts as well, so you can ask them questions, along with extended versions of these interviews that you can watch at your own convenience. Please make sure that you subscribe and you share the videos. Right about now, we're giving way for Nurse Jem. He is a nurse practicing in New York. He moved there in 2006, but he was practicing as a nurse also in the Philippines since 2002. He has tested positive for COVID. He is in quarantine. Aside from being a medical frontliner, he is a father with a 4-year-old son that he hasn't seen for a while. He says he drives by just to wave, and he sees his son wave back at him. It's very touching, his story, and here is our interview with him. Nurse Jem, you've been practicing as a nurse for 18 years now. How bad is it these days?
It's really bad. For patients with underlying issues like hypertension, diabetes, obesity, and others, they can die in few hours right after they've been admitted. But for patients with no issues or asymptomatic, it's still bad because you can be infecting and spreading the virus to others without you knowing it. And for us health workers, doctors, and nurses, it's still very bad because we're dealing with something unknown. So how could you treat someone if you don't know what you're doing?
Nurse Jem, here in California, we have been under shelter-in-place order going on week 8 now. In New York, is it still being practiced? Is that helping?
Social distancing really works. Not only you're stopping, because this virus will stop. If the virus doesn't have a host, then it will just die by itself. So definitely social distancing helps. And it lessens the burden because there will be less and less admission, and only those who are critical and the ones who are really needs medical attention will be brought to the hospital.
And as frontliners, you also are exposed. I know you have your PPEs, wearing masks, making sure that you're protected all the time, but there's also some space for human error. And I know that there are some instances when medical workers have been tested positive or have tested positive for this virus, and I understand that you also have tested positive for COVID.
First, that's the main reason why my department, we were all exposed, because we were very careless and we were taking it lightly at the very beginning. But first, we don't know exactly how it is, how the transmission was. So I think that's the reason why we were not prepared. There's no proper PPE at the beginning.
And in order to get tested, you must have symptoms of fever. But did you show any of those?
Unfortunately, not only me, when we had the symptoms at the beginning, testing were not available. Or we were, even should I say the word, we were prohibited to be tested. So 3 weeks after testing were available, so that's the time that most of us already recovered. So we don't have the symptom at all. But still, I went and I just walked in and just forced them to test me.
And what was the testing process like for you?
Your head will be tilted up, and then a nasal swab, that's a long stick that will be inserted through your nose. Once that swab gets into the nasal bone, you will feel the sudden gush of fluid or chemicals that will make you really sneeze, cough, and even cry. And both nasal layers will be tested, and there's also a danger for bleeding. It's not a nice experience at all.
May 6 to 12 is Nurses Week, and like many like Nurse Jem, I know that you guys are making a lot of sacrifices. My brother is an ER nurse working at 2 different hospitals here in California. He's had to leave my parents' house so that he doesn't expose them unnecessarily. So he's now renting his own space, living on his own, and making sacrifices just to help as much as he can. And that's why, whether Nurses Week or not Nurses Week, we need to honor these nurses. If you're just joining us, we have been giving you a lot of information today on the show with an interview with Dr. Francisco C., who's I look beautiful, thank you, with an infectious disease doctor from Las Vegas. He is Filipino, and he breaks down the 10 fine points of coronavirus that we need to understand. And earlier, we started with our interview with Nurse Jem, who has generously shared with us some of his experience as a medical frontliner Filipino working in New York. And this is Lily, if you haven't met her. This is the plight of people working from home, or parents working from home with children at home as well. So yeah, mom 24/7, but also filming this show. We give you now the second part of our conversation with Nurse Jem. It's concerning to me that you had to fight to get tested.
Yes, for the reason that I didn't have the symptom at all. You must have a symptom, at least one, to be tested.
And even if you tested positive, you still have to go to work. You're still working right now.
Yes, because our mandate, we get a memo that we should be working until critically ill. They say, even if you get positive, you just have to wear your mask as long as you're still able to work. And in fact, some of my coworkers, not only a few, but a lot of us are barking like a dog, and we're still working.
Well, there are a lot of other recoveries as well. I mean, for frontliners like you, normally when you get sick, you have to rest in order for your body to recover. But there's no such thing for you guys because you're still having to work.
They worry about staffing. That's the issue. I don't know how they make that concept that sick nurses should still be able to work. They don't realize that we could be infecting other nurses and, of course, other patients as well.
And we thank you for that. We thank you for your sacrifice. We thank you for your service and dedication to your profession. If you can echo this sentiment to everyone that you work with, that we just appreciate you guys. And I know that speaking of appreciation, you're also learning from this experience. What are you learning personally?
I just realized first that you should save yourself, save your family. Don't go out, and don't infect others. And mostly for us healthcare workers, frontliners, experience is not a guarantee that you can take care of anything that comes out, just like this one. This is very strange. I've been through different kind of epidemic before, but this is totally strange. Everybody just die with different symptoms. Before they thought it's just pain, chest pain, shortness of breath, but now it goes to GI, like abdominal pain, diarrhea. It's just very bizarre. It's weird.
Some of the governors are already laying out plans on reopening because of the economy. I know that people are, wanting to get back to work, wanting to start getting income as well. I know that everyone's working on praying for a vaccine, for a cure. What would be your ask to them?
I apologize, but I really have to speak up my mind. I have to tell them, hopefully, they will be infected as well right now. If not, it could be their loved ones. I hope they will see death in front of their eyes, like us frontliners, that seeing death, real death in front of our eyes. Hopefully, they will feel the pain of losing somebody, their loved ones, that they cannot even be at their bedside until they are cremated, so that they will realize that this virus is not alive. This is not a hoax.
And to people that are maybe underestimating the power, maybe, I'm not at risk. I'm fine, I'm invincible, I can go out, I'm young and I'm healthy. What would you say to those people?
If they have that mindset, okay, I will accept that, but stay home. Don't infect others because there are other people who are vulnerable. We have seen death very young people right now. At current, we are now seeing on 20s, 25 to 28, and even have that we have somebody who died last night at 23. So it doesn't mean that if you're young, you'll be vulnerable. It's not true. I don't believe that. That's why I don't spread misinformation. If you have that thinking, just stay home. Don't infect others. Period.
We will have the extended version of this interview on our YouTube channel, so please catch us there because Nurse Jem has a lot more to say. For now, thank you so much, Nurse Jem, and we will be back in touch with you.
Thank you.
That was really a bold statement from Nurse Jem calling out our leaders. You know, this global pandemic has really shown us leaders, has really separated the deserving leaders, the good leaders, and the not so good leaders. We need really leaders to step up and lead us through and out of this pandemic. This is Lily. We have started her YouTube channel. She has been doing some YouTube videos just to help explain things or see things through the eyes of a child. And this is her video on what it takes to be a good leader during coronavirus. Enjoy this one and I'll see you next week.
My mommy said I can be anything I want to be, as long as I work hard for it. Today I want to talk about what I would do if I was president during coronavirus. Telling lies is not good, especially when you're a leader and people listen to you. People want the truth though, so I will tell the truth, even when I be naughty. I will listen to people who know better than me. What do I know about coronavirus? I won't pretend I know everything, because nobody knows everything, not even me. I will admit my mistakes. It's okay as long as you say sorry. So I will say sorry. A lot. It doesn't matter if you're cute or super smart. Daddy says you have to be kind and put other people first. Like when I let Leo borrow my iPad. Because it's not all about me. It's about me and all other people. But I'm sorry, guys. I can't be your president right now. I decided I want to be queen. So stay safe. And thank you all for watching. And don't forget to subscribe. Mwah. Can you take a